Hi, in this video, I will take you through the patient's journey on Healthstack. So I'm going to be assuming the role of front desk, a nurse and a doctor to show you how you can use the platform to manage your patient all through their visit to your clinic. I'll log in first as a front desk officer. Let's say a patient just walked in and this patient needs to be registered because they are a first time, it's their first visit. They are not a returning patient. If you have, or if you are seeing a returning patient, searching for the patient's name through the list of clients or patients would be the best thing to do. So if I had a patient, Eva, I will search for Eva, click on her name and schedule an appointment for Eva. If Eva is an HMO patient, once I schedule this appointment, I would make sure that she gets an email so that she can send me her code for check-in. That way she can be checked in and the HMO can also be notified that Eva was checked in at a particular time and date. You can also generate a patient ID card. I think I would demonstrate that with a patient that has an ID. So let me use Max Pan. If I click on this patient Max and I say generate ID, this is what you get for Max Pan. So let's say we have a visiting patient for the first time and we need to register the patient. You can either do a quick registration or you can do a full registration, whichever works. So let me say the name of this patient is Nini Black. Nini Black. Date of birth for Nini Black is let's say 1965 January, and Nini Black is female. Phone number for Nini, email for Nini, nini@test.com. Marital status for Nini, Nini is married. Medical number, so let's say Nini is patient number, this is optional, so let's say she's patient number 4567. Religion for Nini, Christianity. Let's say profession, Nini is a medical doctor. Tag, so let's say Nini. Tag is what you can use to search out the patient in future. Client level, so let's say Nini is a level 2 patient. That's just the level of privacy that Nini's records can have on the platform. Nini's address, so let me say 1 Hastings Street. So you can search in an address that pulls a Google pulls the Google map to kind of verify your address. I won't be doing that for sake of time. So let's say this is Lekki, this is Etiosa, this is Lagos and Nigeria. So because we're doing a full registration, I will do blood group. Let's say Nini is A minus. Genotype, Nini is AS. Disabilities, Nini has none. Allergies, Nini is allergic to peanuts. She's allergic to dust and cold. Comorbidities, Nini has none. Specific details, there's none. I'll just leave that. Yeah. Full name for Nini's next of kin. I'll say next of kin. That's just me saying that's the name of Nini's next of kin. Phone number for next of kin. Email for next of kin. I'll use the same email that I used for Nini. Let's say this Next of kin happens to be Nini's spouse. Let's see, sorry, spouse. And does this spouse have any comorbidities? I say no. So I'll just register right away. What we've just done is successfully register Nini as a patient in this hospital. Now Nini's here. We're about to schedule an appointment for Nini so she can see a doctor. This is the appointments page. We can see that showing based on the date filter that we have, there's no appointment for today. If you remove this filter, you will see all appointments over a period of time. I'm going to create an appointment for Nini. I'm going to check. So you see how I searched for Nini and it pulled up Nini's details. Nini Black, 58 years old, female, medical doctor. This is her phone number. Nini is a cash paying patient. She has no HMO cover. For the sake of this demonstration, Nini will be seeing Dr. John. John. Sorry, yeah, Dr. John. And Dr. John is in, let's see, Dr. John is in Gynae Clinic. Yeah, it's an on-site visit. What's the date and time for this appointment? The appointment is for today. It's actually for 8 a.m. Oh, sorry. Sorry, this is supposed to be 8. So, yeah, for 8 a.m. Appointment type is new, being that it's a first time visit. It's been scheduled. This is optional. So because this is optional, I just said no complaints. So you can tick this to send an email to Nini to notify her of this appointment, or you can uncheck since Nini is already here and click on create appointment. Once I create this appointment, the doctor would get a notification if they are logged in that there is an appointment waiting for them, and it's for 8 a.m. So this is how you deal with a patient that walks into your hospital, using Healthstack. So let me assume the role of a nurse. Now, I'm logged in as a nurse and Nini is here to take her vitals. I'll go to clinic. Let me first state that you will be assigned only modules that apply to the roles that you are currently engaged in at that hospital. Nurses would usually get clinic, they would get theater, they would get a ward, and sometimes nurses get epidemiology. So I'm going to click on appointment as a nurse, and you will see how the appointment we've just created for Nini is not here, despite the fact that the date filter says, pull out every appointment for the 18th of April. If you check the location that this nurse is currently logged on to, you find out that she's not currently logged on to Gynae. So I'll just change my location to Gynae Clinic, and you can see that, okay, this is Nini's appointment. So let's note that once you specify the clinic that or the location that the patient is, going to visit, nurses and doctors will need to, visit that location to be able to assess the appropriate appointments. So I'm going to click on this appointment and just check Nini in. Nini has been checked in, and I'm going to attend to Nini. This is Nini's documentation page. Every patient on the platform has one. This is where you store up every documentation, every encounter, every detail, that relates to that patient on the platform. You can see the details we entered during the patient's registration. Nini is 58 years old, A minus, AS. Nini's tag is Nini. She's a cash paying client. I can view Nini from here. I can view Nini's account from here. You can see details about, allergies, comorbidities, disabilities, and all of that. So as a nurse, I'm going to click on new documentation, go to vital signs, and this is me taking Nini's vitals. So let me see, Nini's temperature is 36, pulse is 62. I'm sorry, I don't know a lot about pulse. So let me see, this is 144. I know a lot about BP 120, 100. I'll just leave so a lot of these things you might leave out as long as it doesn't apply. So let's say on a scale of 1 to 10, Nini's pain is 6. If she has any, Nini's height is 6 and Nini's weight is 90. So I'm going to save this as final. If I save as draft, it means that I want to come and modify this document later in the future. So let me save as draft so we can see. So I'm only going to do this once. And once I click on this document again, you can see that I still have an opportunity to make a change to this document. So let me say Nini is actually 5.8 and I'll go to final and save this document. So as a nurse, I've just, taken the patient's vitals and you can see the details here. You can tell that Nini is underweight and at least this gives the doctor a good starting point, for their consultation. Nini's documentation, vitals has been taken, and Nini can now proceed to go and see the doctor. So I can see vitals taken so that we're clear on that. And now Nini is going to see the doctor. She's done at the nursing station. She has had all her, complaints, laid out to the doctor, and the doctor is about to document. The doctor goes to clinic, goes to appointment, same, way the nurses would, and click on attend to clients. Doctor comes here. Doctor can view, documentation about vital signs, do their own documentation. We have a list of documents that doctors can use. You can do a new patient consultation. It's a long form. You can do this to get started with the patient if it's a first encounter, or you can go straight to create a clinical note. I'm not going to do a new patient consultation because it will take time. I'll just do symptoms, pain in lower back, clinical findings, pain, diagnosis, so let's say cysts, plan, lab tests, and pelvic scan. Yeah. So, okay. And I'll save as final. So, okay. And I'll save as final. So now I've determined that this patient, should go for some lab tests and pelvic scan. I'll go to action and send out a request for lab test. So I'll say this patient can do, let me see if we have any hormonal, okay, hormonal profile. Sorry, I'm just, this is just for the sake of demonstration. I'll click on add. You can see what I've requested for. I click on complete. So whoever it is at the lab would get that a notification straight away that there's a pending hormonal test to run for a patient called Nini Black. I'm going to send out a radiology request also. I'll be requesting pelvic scan. I don't have any instructions, so I'll just add. And I also request for abdominal ultrasound. Okay, abdominal, no. Okay, abdominal pelvic ultrasound. Just say different from PUSS. No, sorry. No, let me change that. Abdominal Okay, yeah. Let me see, rule out fibroid. Yeah. And I'll add. So let me just state that if any of these services you require would involve a third-party provider, you might want to change the destination. Now, this can only apply if the third-party provider is registered on Healthstack. So a nice thing to do would be to get third-party providers for your hospital to get registered so that they can take your requests for your patient, and that way they can send in results easily to you. I'll click on complete and we're done with this order. So like I said, those of them that the lab or the radiologist would be, the radiology technician would get a notification that there's a test pending for them to take care of. Now we can see that we've responded to this patient one way or the other. We can choose to admit this patient by going to end encounter and click admit to ward, send out a request to admit to ward. You can also send a request to discharge from ward. A good thing to do would be to also send out a prescription for this patient. So let's say we want to manage the patient in time because of the pain. We can give IV morphine 2 times today only. I'll add and click complete. Yeah, so I've just sent out request for IV morphine. Once this patient goes to take that IV, the nurses will click on medications here, and you can see the medication that is waiting, to be administered to the patient. Once I'm ready to give the, so let me say a new comment would be given at 12, no, at 8:30 a.m. next at 6 p.m. And action, let me say administer. So what I'm trying to say is I'm about to administer 2 milligram morphine for this patient, and I'll click continue. So this drug has been administered. You can see the details of this drug administration. You can tell when the last administration was made. You can see the comment that was made by the nurse or the doctor that made that administration. You can tell who did that administration or who administered that IV to the patient. So let's go to the lab. As a lab technician, I've just gotten a notification that there's a pending lab result, assuming I was logged in, to the platform with my lab technician account. So I'll go to bill lab orders. So all lab orders that were sent from the clinic, you would have to bill them from here before you can be able to, report and send, those reports to the patient. And to report that lab result, you go to lab results. You'll find all lab results that are available, and you can report those lab tests appropriately. The reason why I'm not going to go into details is because there's not a lot of time. I would also, it's the same thing that applies for radiology. All radiology orders will be sent to radiology order, and then you can create results by going to radiology report. The same process. To report, you will find the name of the patient and you just create a report. So we don't have that report, the patient's name here, Nini here, because we have not built that order. So okay, maybe I should just demonstrate one. So this is the order that was sent from the clinic just now for Nini. 2 pending investigations. We can see abdominopelvic and pelvic scan. So if I click on this and let me search for abdominopelvic, you will see that we don't have that service in our list of services. So the reason might be because we're not offering that service, or maybe the front desk persons or the billing or accounting people have not set up these services completely. So let me search for any cervix. Okay, we have abdominal pelvic USS. As I click on this, is 10,000 naira. I'll add it. So we can do just one of these services because this is the only one that's available in, So we can see the name of the patient we're billing. We're billing this patient by cash, time and date, invoice number, the total amount, what we are billing for, the status of this billing. This is where you actually create the billing and you add that billing to this. I will click on done to say that okay, I'm done billing this patient. She can now pay at the front desk or at the cashier's office. So remember, we also sent out a prescription for IV morphine that has been administered. And so let's say that this patient, we need to also bill this patient for that medication as well. Let me state this before continuing, that the your clinic workflow would differ. In some hospitals you need to pay before you access a service. Sometimes you need to access all of the services and then you get to pay for it. Whatever works, Healthstack is really flexible and allows you to go whichever the way the workflow for your hospital goes. So this here, we are billing for IV morphine for this patient. Click on that. You see how I clicked on the order, and the same form I can search if we have IV morphine. I don't think we have morphine in, so there's no morphine in our inventory. There's no way I can bill for morphine if we don't have morphine in the inventory. So let me go to the inventory and quickly add morphine. So this is how you add products to your inventory. So let's say we bought morphine at 10,000 naira. What's the name of the product? Morphine 2 mg. So there's no morphine 2 mg. Going to add. Okay, drug. Product category is drug. Product name is morphine 2 mg. Base unit is in file. I'll create. So I've just successfully created that. Sorry. So this is morphine 2 mg, and we bought about let's say we bought 10. Okay, we bought 100. The cost price for one is 1,000 naira, and we bought 10. I'm going to add this product. So you can also upload a product to your inventory as well, but in this case I'm just adding one product, and voila, we've just added morphine to our inventory. So I need to set up the selling price for morphine. You can see morphine that I just added now, morphine 2 mg, 10 vials of morphine. The stock value is 10,000 naira. The cost price is 1,000 naira, and we haven't specified the selling price. So I'll click on morphine. I'll set the price. The selling price for morphine, let's say, is 2,000 naira. I'll save that. Also, I will need to set up a reorder level for morphine. I'll say, okay, as soon as we have just 2 morphines, please let us know so that we can restock. Also, I'm going to set the batch details for morphine. So let's say the batch number for morphine is this, and the expiry date for the morphine that we have in stock is billed for 2024 January, and 10, I think about 10 of them would expire in January, and I'll save. So now we've built a profile for morphine. Let's go on to build this patient for morphine once again. click on this pending morphine IV. Oh, I forgot to add. Okay, so let me say morphine. Now we have morphine, and we are billing this patient for one. I'll add and I'll click. So done. We've just billed this patient for the lab order that was sent from the clinic. So let's go ahead to receive payment, process payment for these services that have been billed for this patient. So if you go to finance, you go to payments, you will find a list of all unpaid bills and invoices, raised from different departments, from lab, from radiology, so it depends. If you raise bills from the different locations, let's say once the patient gets to lab, they are billed there. Once the patient gets to radiology, they are billed there. Once the patient gets to clinic, they are billed there. You can raise all of those bills and come here to make an overall payment, or you can decide to process payment at the individual locations. Otherwise, if you have only one point of raising bills for patient, what the person will need to go is go to bill services, create a bill for that patient. Once you've created that bill, you will find the details of the bill here. Like you can see now that there's a bill for prescription 2000 and there's a bill for radiology. You can see all the things that we're billing this patient for. You can also create a bill from here, like from bill services, or you can just come straight to unpaid, no, to payment to make payment. So if I can either click on this to reveal the services that we are billing for. You can decide to print an invoice and select what account you want the patient to make payment by. You can change this and print or send by email. Another thing you can do is make payment. Click on make payment to go ahead to make the payment for the patient, or you can just go straight by clicking on pay, and it takes you straight up to where you are supposed to process the payment. You can tell the bill that you're making payment for. You can make payments. This is the total amount due. You can make part payments, or you can make full payments. So or you can decide to pay each of these services in parts, and yeah, as the case may be. So for the sake of this demonstration, let me show you how we can do this. You need to add some money, make a deposit. So let's say this patient makes a deposit of 10,000 naira. 10,000 naira. And the payment detail, fidelity transfer. So you can change the mode of payment to bank transfer and click on accept. Okay. Yeah, so we've just accepted the money. You can see that the current balance changed from 0 to 10,000. Now we can say, okay, we are making part payments of 10,000 naira, and I'll click on pay. What we've just done is make part payment successfully. If you go back to the payment schedule for Nini, you will find that Nini has a balance, that's pending. So whilst they are, doing the lab tests and everything that needs to be done, Nini can, make payment afterwards, complete the payment and get her results. However, your workflow for your hospital might be. So this is how you manage a patient on the Healthstack platform. Yeah. If you have a patient a request for admission, you go to Word, click on admissions list. Remember I showed you how you can send a request for admission. When you click on admission list, all you're saying is you want to see a list of all requests that have been sent for patient admission. Once you see that list, you can process that admission request and get that patient admitted to become an inpatient. And you can manage the inpatient from here like so, until there's a request to discharge the patient, which you can process here as the case may be. Okay, so yeah,